Good morning, everyone. My name is Mike Gilchrist, and I'm one of the third-year residents here at the Mayo Clinic in Rochester. I'm starting a day here for AM/PM coverage on the hospital service, something our second and third years do throughout the year. After a quick drive down the street from my townhome where my wife, my dog, and I live, I start the morning out at the St. Mary's Hospital. These days are a great representation of the different variability we can see on a daily basis, especially on our hospital service. Morning duties, after getting signed in, include getting a quick sign out on the people I saw that morning from the night team, which included some residents from our first and second year teams in the call pool and over the night in the night shift. I quick reviewed the charts, eyeballed things, and off I went to pre-round on my patients. After the team finishes rounds and sees the night team's patients, then mine, I'm headed off back to my car to make the 20-minute drive out to the Kasson Clinic, where we're going to start our afternoon together. On the way out, being that it was a bit of a longer morning, I'm going to stop by the Erdman's grocery store to get a quick lunch from the awesome folks behind the counter in the deli. Particularly this day, I think it was a fried chicken mood that I was in. A short jolt down the street, and I'm back at our home base at the Kasson Clinic on Main Street. We're going to start our afternoon with a couple extra to-dos that I hadn't gotten done the previous day. I'll quick log in, get a few in-baskets caught up, and check a dosing regimen for a refill that I had been handed to me by our nursing team. After teeing up a few extra things, we'll get a list printed out for huddle, where I told our nurses everything I'd need for my patients that half day and answered our surprise question. That being, would you be surprised if anyone on your schedule passed away in the next year? If that answer is no for anyone, this would prompt us to provide forms and info that prompt goals of care discussions for those appointments. Then, we're sitting down with Dr. Boswell for a 30-minute chalk talk on the different diagnostic tools we can use to discern between type 1 and type 2 diabetes in pediatric patients. Afternoon huddle wrapped up, so I went over to touch base with a couple of folks, Dr. Garrison, Dr. Decker, and Dr. Munir before I started seeing patients. Skipping toward the end of the day, I'm headed back home, east to Rochester, after getting all of my notes done. Big perk of Minnesota is having a lot of daylight in the summer that you can start to take advantage of after the shifts in the clinic and the hospital. Why this is nice is because you get to come home, see your puppy, and with everything wrapped up for the day, head out for a lake lap with your family.